Hello! Today we will take the Praxiject challenge with 3 healthcare professionals. The goal is to compare 2 brands of saline syringes to find out which brand is the best. The Praxiject challenge is divided into 3 parts. The participants will test the packaging, the pressure, and the taste. Let's do it! Let's start with the packaging to assess which one is easier to open. So Sarah, which one did you prefer?
Actually, I preferred the A product. It was easier to open and manipulate as compared to the B product that was difficult to open, and it also ripped when I opened it. So I like the A product better.
I definitely preferred the A. It was a lot easier to open the packaging. I felt that I had more control over it. With the B, what concerned me, actually, was not only was it more difficult, and with gloves it would be even more difficult than that, was that as I was unrolling, I was seeing the little debris falling. So I would definitely not be using this on my sterile field.
I preferred A. I liked the plastic packaging. I found it was easy to open. And honestly, when I used B, it's paper packaging, it can tear, it can leave pieces sometimes, and also when you open it, sometimes it can go flying. So I preferred A.
Praxiject is better adapted for sterile field use because the packaging is made of plastic and doesn't release any particles when it's opened. The competitor's packaging is made of paper. This explains the presence of non-sterile particles upon opening the package. Now, we will evaluate which plunger is easier to push with the pressure test. Rui, in your opinion, which plunger is the easiest to push and is easier to control?
Okay. When using the 2 plungers, A, I felt I was in control the whole time. I was easy to push, and I knew when it was gonna come out. With B, I didn't feel in control at all. Every time I pushed, I didn't know when it was gonna jump out. And we often use syringes to irrigate wounds, to clean them. And I would not use this type of syringe. I would be concerned to hurt the patient because I don't know when the pressure is coming out. So I would definitely not use B.
I would say the A was really easy to work with. It was easy to push, it was smooth. As compared to the B, I felt a lot of resistance and pressure to manipulate the B. So the A is definitely the best one for me.
Again, I'd have to choose A. The minute I took the tip off and applied just a bit of pressure, I felt that I could control the pressure and it was even and steady throughout. Whereas with the B, I tried to use the same amount of pressure and it did not budge at all. So I had to use quite a bit more pressure to actually activate it in the first place. And then once it went, it was just too fast. So what concerns me about this, to be honest with you, is if I'm irrigating the base of a wound, it might actually damage the new tissue. The other scenario would be if I'm irrigating in a catheter, it would be perhaps a bit too much pressure as well. So for sure, the A.
The high pressure required to activate the piston may cause damage to catheters and veins. But why does one syringe require less pressure than the other? Since the Praxiject syringe is sterilized at low temperature, the pressure required to activate the piston is at minimum. The Praxiject syringes are easier to activate. Sterilization at high temperatures has the effect of adhering the piston to the barrel, and the pressure required to activate the piston becomes very high. This is the case of the competitor. For the last test, our participants will taste the solution of each syringe. Since this is a saline solution, it should taste like salt water. According to you, José, which product tastes more like a saline solution?
The A, absolutely. Right from the start, there's a very salty taste to it. So it's unpleasant, but very clear that it's saline solution. The B, however, doesn't taste at all like saline. It had such a taste of chemicals that I had a hard time swallowing it. So again, it would be A.
A tastes more like a saline solution. When I taste it, tastes like plain salt water. So that definitely was normal. B had a really horrible aftertaste, and I actually still have it in my mouth right now. So definitely, if I had to taste one, it would be A.
I would choose the A product because it really tasted like salt and water, as compared to the B product, which had a little taste of like plastic, chemical-like taste. So definitely the A product.
Since the other brand is sterilized at high temperatures, chemical components are extracted from the syringe's plastic and rubber piston and are then introduced into the solution. Once the liquid is injected into the body, volatile organic compounds move through the blood to the lungs and cause bad taste and/or odor that may cause nausea and vomiting. In addition, one might ask, what would be the long-term effects of these chemicals on patients' health? The Praxiject syringe, which is sterilized at low temperatures, has less side effects during its use. In conclusion, we invite you to perform the challenge yourself. You will see that although both syringes will do the job, Praxiject's package is easier to open and better adapted for use in a sterile field. Its plunger is easier to push, its solution tasted like salt water and has less side effects. For more information on Praxiject, visit our website at praxiject.com.